Shortly, we're going to have an opportunity to vote on moving forward and considering health care reform in this country. And I first want to thank the Majority Leader, Senator Reid, for putting together the bill that came out of our two committees that accomplishes what I think are the three goals that we need to do in health care reform. I've been asked by the people of Maryland whether I would support a particular bill, and I told them in order for me to vote for the bill, it has to do three things. First, it needs to bring down the cost of health care in America. Secondly, it needs to provide an affordable, quality insurance option to every American. And third, it must be done in a fiscally responsible way. Now, the bill that Senator Reid is bringing forward accomplishes those three goals. First, it brings down the cost of health care in America by about $1 trillion. It does it by investing in prevention and healthy lifestyles, by cracking down on fraud, waste, and abuse, and by eliminating unnecessary administrative costs in our health care system. That's the way we should bring down health care costs in America. That will improve quality, but bring down cost. Secondly, this bill allows every American to have access to affordable health insurance and health care. The Congressional Budget Office estimates that the bill will reduce the number of uninsured in America by 31 million. We will be able to get 98% of Americans who are in this country legally, citizens, covered by health insurance as a result of this legislation. And then third, Mr. President, this bill moves forward in a fiscally responsible way by not only staying within our budget, but actually reducing our budget deficit by $127 billion. No new tax burdens on middle-income families. I'm particularly pleased that this bill will help middle-income families in America. Mr. President, I know you have received letters from your constituents. I've received letters from my constituents that really tell us that the status quo is unacceptable for middle-income families in America. Let me just give you two examples of people who wrote me. I got hundreds of letters from Marylanders telling me that they cannot make it under the status quo. This is Meg from Rock Hall, Maryland. Rock Hall, Maryland's on the Eastern Shore. She's a healthy, active 62-year-old woman. She plays tennis 4 times a week. She's not on prescription medicines, has never had a major medical issue. She wanted to change her insurance coverage. She has insurance, but she wanted to go to a more affordable insurance plan for her family. She was denied coverage. Why? Because she had received counseling 3 years earlier due to a stressful family situation, and because she had a slightly elevated cholesterol level. Now, her cholesterol has been brought under control, taking over-the-counter medication, and she hasn't had counseling in over a year. She writes to me, and how do I answer that? It says, if I am considered high risk, where does that leave Maryland residents who have serious health conditions or on medication or requiring ongoing care? Well, Meg is absolutely right. The bill that the leader is bringing forward will deal with middle-income families such as Meg by telling health insurance companies that they cannot participate in such discriminatory practices by restricting on pre-existing conditions. In fact, Meg doesn't have pre-existing conditions, but they're using that to deny her full coverage. Earlier this week, Cynthia and Eric Cathcart came to Washington, came to this Capitol to tell us their stories. I must tell you, I was shocked to hear their circumstance. Here are two individuals who are self-employed, trying to make it. They have 2 children, and they're trying to get along. I tell you, when Eric told us that he is basically giving up on his business and is going to have to work for a larger company because he can't afford health insurance. And Cynthia, who is the piano instructor, tells us the same story. Now listen to this. Here's a husband and wife, 2 children, and they can't get an insurance policy to cover their whole family because of the pre-existing condition restrictions. This is a small business owner that's going to literally have to give up their businesses. Now today they have 2 separate insurance plans. One for the husband and the child, one for the wife and the child, because that's the only way they could get it. They got to pay 2 separate deductibles because they couldn't get an insurance plan to cover the whole family. And the amount of money they're paying for health insurance is prohibitively expensive. Well, the status quo is not acceptable for the Cathcarts and shouldn't be acceptable for any of us. Under the health care bill that the leader is bringing forward, those discriminatory practices by private insurance companies would be prohibited. And the Cathcarts would have an option of a lot of different plans they could choose from to cover their entire family without separate deductibles for different members of their family. Well, that's the type of health care reform we need that will help middle-income families in America. It'll help middle-income families by bringing down the cost of health care. The cost of health care in America is growing at way too fast of a rate. 10 years ago in Maryland, it cost an average family about $6,000 for health insurance. Now, maybe their employer paid part, maybe they paid part. Well, today that's $12,000 a family. By 2016, it'll be $24,000 a family if we don't take action. We need to help middle-income families. We need to move forward with health care reform. The average family in Maryland today is paying $1,100 per family for the cost of those who don't have health insurance. Those that have health insurance are paying for those who don't have health insurance. That's why the bill the leader is bringing forward that will cover 98% of Americans are going to help middle-income families by eliminating that hidden tax of $1,100 per family in Maryland and around the country. Healthcare costs is growing 3 times faster than wages are growing in America. Inaction should not be an option. For small businesses, the situation is very dire. They're spending 20% more than a comparable company that does the same business that's larger. Just as stressful, they can't predict what the annual premium increase is going to be, which means how can you run a business without knowing what your costs are going to be from one year to another. For the sake of small businesses, we need to move forward with health care reform. A lot of families in Maryland depend upon Medicare. A lot of middle-income families in Maryland depend upon Medicare. Well, this bill will strengthen Medicare by dealing with the underlying cost of health care, by getting that under control. And at the same time we protect Medicare for the future, we provide additional benefits for our seniors by starting to close the donut hole, getting prescription drugs more under control, and providing preventive care to our seniors. This legislation will help middle-income families by dealing with insurance reform, to eliminate pre-existing conditions, to provide larger pools, to offer more choice for middle-income families. Mr. President, this legislation will help workers who work for small companies, will help those people in our community that have pre-existing conditions, will help those people in our community who are changing jobs, will help those in our community who depend upon Medicare. This is legislation that is critically important for middle-income families in America. Status quo is unacceptable. We need to act, and we're going to have a chance to do that when we vote Saturday on proceeding with health care reform. I urge my colleagues to move forward on this vital legislation for America.